Good morning, everyone. Bonjour tout le monde. Bon vendredi. Je suis heureux d'être joint aujourd'hui virtuellement par les ministres Anand, Hajdu et LeBlanc, et aussi par le Dr Tam, le Dr Njoo et le Major-Général Fortin. Demain, pour plusieurs étudiants au Québec et au Nouveau-Brunswick, c'est le début du congé de la semaine de relâche. C'est une semaine qui est bien méritée. On sait que c'est pas facile pour les jeunes et pour les enseignants présentement. Alors, profitez-en. La température s'annonce pas trop froide. C'est un bon moment pour jouer dehors et faire des activités extérieures. Mais il faut absolument continuer à faire attention. La vaccination de masse commence, le printemps arrive, mais on ne peut pas laisser cette relâche ruiner nos efforts des derniers mois. Alors, suivez les consignes locales de santé publique. Évitez les rassemblements. Ce n'est pas le moment d'être plusieurs familles dans la même maison ou le même chalet. Avec les nouveaux variants, on ne peut pas prendre de risques. On veut tous que le printemps et l'été soient meilleurs. Alors, s'il vous plaît, soyez prudents. This week, Canada received a total of 643,000 doses of the Moderna and Pfizer vaccines. This is our largest week of shipments to date. Vaccines will keep arriving faster and faster as we head into the spring. And not just because shipments of Moderna and Pfizer are ramping up, which they are, but because Canada has now approved yet another vaccine option. This morning, Health Canada authorized the AstraZeneca Oxford COVID-19 vaccine, as well as the Serum Institute of India's version, Covishield, which is sponsored in Canada by Mississauga's Verity Pharmaceuticals. In other words, we now have a third safe and effective vaccine independently approved by health experts in Canada. This is very encouraging news. It means more people vaccinated and sooner. Because for AstraZeneca, like we were for Pfizer and Moderna, we're ready to get doses rolling. Canada has secured 2 million doses of the Covishield vaccine through an agreement with Verity Pharmaceuticals and the Serum Institute of India. With the vaccine now approved in Canada, our first shipment of 500,000 of these doses will arrive within weeks. The remaining doses are scheduled for delivery over the next couple of months. These 2 million doses are in addition to the 20 million doses we've already secured with AstraZeneca that will start arriving in the spring, and any AstraZeneca doses that Canada receives from COVAX will be added to that total. So there are a lot of numbers out there. Here's the bottom line. With Pfizer, Moderna, and now AstraZeneca, Canada will get to more than 6.5 million doses by the end of March. And there will be tens of millions more doses to come between April and June. I want to express my appreciation for the support and partnership of the Indian government in fighting COVID-19 and helping secure these doses for Canadians. I also want to thank Minister Anand and our teams at Public Services and Procurement Canada and Global Affairs Canada for their outstanding work on this file, both here and in India. Ce matin, Santé Canada a autorisé le vaccin d'AstraZeneca développé en partenariat avec l'Université Oxford. C'est une très bonne nouvelle. Aujourd'hui, je peux annoncer que le Canada a conclu une entente avec Verity Pharmaceuticals et l'Institut Serum en Inde pour recevoir 2 millions de doses du vaccin Covishield basé sur celui d'AstraZeneca. Je peux confirmer qu'on va recevoir 500 000 doses grâce à cette entente dans les prochaines semaines. Le reste va arriver dans les prochains mois. Ces 2 millions de doses s'ajoutent aux 20 millions de doses déjà prévues avec AstraZeneca et aux autres doses que le Canada va recevoir par l'entremise de l'initiative COVAX. Donc, en résumé, d'ici la fin mars, en comptant Pfizer, Moderna et maintenant AstraZeneca, le Canada aura reçu un total de plus de 6,5 millions de doses de vaccins contre la COVID-19 et des dizaines de millions d'autres suivront entre avril et juin. I know that vaccines are on everyone's mind right now. You're looking forward to you and your loved ones getting your shot. We're working around the clock to make sure that happens as soon as possible. Deliveries are ramping up. We've got incredible people right across the country working as one big team towards the same goal. Just take Brianna from Kamloops. Brianna is a frontline nurse who sent me an email recently, and I'm glad she did. Because to you, Brianna, and to all the nurses, doctors, and healthcare staff out there, I want to say this. Thank you. Every day, you're making sure that your fellow Canadians get tested, get vaccinated, and stay safe. You are our heroes. As vaccinations ramp up across the country, many provinces have expanded the number of health professions able to administer the COVID-19 vaccine. If you're a dentist, a paramedic, a midwife, a pharmacy technician, or a retired nurse, we need your help. And people like Brianna need your help too. Together, we will make sure that every Canadian who wants it will be vaccinated by September. J'aimerais maintenant enchaîner avec une autre bonne nouvelle. En juin dernier, l'Organisation de recherche et développement FP Innovation au Québec, qui crée des solutions pour faire croître le secteur forestier canadien, s'est donné comme but de développer un masque compostable. En partenariat avec Ressources naturelles Canada, ils ont maintenant créé un des premiers masques non médicaux compostables au monde. Ces masques pourront être fabriqués à la base de fibres de bois par des producteurs canadiens avec des matériaux d'ici. Merci aux gens impliqués pour votre leadership et bonne chance dans votre prochain défi de développer un masque médical de niveau 1 complètement biodégradable. C'est en continuant de rassembler nos forces et de notre savoir-faire canadien qu'ensemble, on va traverser cette crise. D'ailleurs, en parlant de rassembler nos forces, on a eu une semaine très productive et positive en ce qui concerne nos relations avec les États-Unis. This week, we agreed on an ambitious and comprehensive roadmap for renewing the partnership between Canada and the United States. And we got straight to work. On Tuesday, Deputy Prime Minister Freeland, Minister Garneau, and I had a very productive meeting with President Biden and Vice President Harris. It was great to see that we're on the same page when it comes to so many of the challenges our world is facing, whether that's ending COVID-19 or rebuilding our economies in a way that supports the middle class and creates good jobs. We're on the same page, too, when it comes to fighting climate change and working together to build a more peaceful and prosperous world. Of course, our collaboration with the new administration didn't end with the meeting we had on Tuesday. On Wednesday, Minister Wilkinson had a meeting with Special Envoy for Climate, John Kerry. Yesterday, Minister Al-Khabra and Transportation Secretary Buttigieg released a joint statement on how our country's transportation sectors will tackle climate change together. And today, Minister Garneau and I will meet with Secretary of State Blinken to discuss defending human rights around the world, among other things. As partners, allies, and friends, I know we're going to work together to make life better for people on both sides of the border. And right now, job one remains beating this pandemic. We still have to be very careful, especially with new variants out there. We all want to start the spring in the best shape possible. That's why rapid testing continues to be an important part of our strategy to fight this virus. On that front, we're going to keep sending rapid tests to the provinces and territories while we also work with the private sector to get more Canadians tested. And finally, I want to end this morning by recognizing that today is the Lantern Festival, which marks the end of Lunar New Year. Just like with Black History Month, which ends this Sunday, celebrations were different this year. But what will never change is the fact that year-round Canada is stronger because of the incredible contributions of Asian Canadians, of Black Canadians, and of everyone who calls this country home. Now, more than ever, as we face these tough times, we need to come together and stand strong and united. Last week, the Vancouver Police Department released data that shows that anti-Asian crimes in the city rose by more than 700% in 2020. Too many other cities have also reported significant increases of these hateful crimes, including here in Ottawa. And in Edmonton, there's been a recent series of appalling attacks targeting Black, racialized, and Muslim women. To the victims, we stand with you. There is no place for this in Canada. These acts are unacceptable and they have to stop. Ce sont des moments difficiles et il faut continuer de s'aider et de travailler ensemble maintenant et pour l'avenir. Merci tout le monde. Je suis maintenant heureux de céder la parole à la ministre Anand. Anita.
Thank you, Prime Minister, and good morning, everyone. We have seen a record number of COVID-19 vaccines coming into this country over the past week, and this will continue over the next weeks and months as we continue to see millions of vaccines coming into this country. We have continually said that when a vaccine is ready, Canada will be ready. And today's announcement that Health Canada has approved the AstraZeneca vaccine is testament to our strategy of diversification. In other words, we pursued advanced purchase agreements with 7 leading vaccine manufacturers to place Canadians in the best stead possible. Once a vaccine was approved by Health Canada, we wanted to make sure that every Canadian had access to a vaccine. And our strategy of diversification continues to see results. As the Prime Minister just announced, Canada has secured 2 million doses of the AstraZeneca COVID-19 vaccine through an agreement with Verity Pharmaceuticals and the Serum Institute of India, in collaboration with AstraZeneca Canada. Following this morning's announcement that the vaccine has been approved by Health Canada, I am pleased to confirm that the first batch of doses, consisting of 500,000 doses, will be delivered to Canada in the coming days, and they will then be distributed to the provinces and territories. The remaining 1.5 million doses are expected to arrive in the coming months. Je suis heureuse de confirmer, suite à l'approbation de ce vaccin par Santé Canada ce matin, que les 500 000 premières doses arriveront dans les jours qui suivront et seront rapidement prêtes à être distribuées aux provinces et territoires. Les 1,5 million de doses restantes devraient arriver dans les livraisons prévues au cours du printemps. These new doses are in addition to the 20 million doses already secured through an earlier agreement with AstraZeneca. We expect to start receiving those doses in the second quarter, and today's Health Canada regulatory approval will allow us now to firm up the delivery schedule, which we will share with you as soon as it is confirmed. Avec les annonces d'aujourd'hui, je tiens à réaffirmer que nous serons en mesure de fournir d'ici la fin du mois de septembre un vaccin à chaque personne au Canada pour qu'il est recommandé de recevoir un vaccin contre le COVID-19. My Department of PSPC and I continue to leave no stone unturned to bring as many vaccines as possible into Canada as quickly as possible. We know that with the rollout of vaccines, the ongoing use of rapid tests, and following public health measures, we can combat this virus once and for all. Today's announcement that AstraZeneca vaccines will be arriving now that they have been approved by Health Canada is good news for Canadians. Thank you. Merci, Miigwech.
Minister Hajdu?
Thank you very much. And thanks, Prime Minister and team, for great news today. And of course, this means we now have 3 approved vaccines in Canada, Pfizer, Moderna, and now AstraZeneca. And a new vaccine means there are more options for Canadians. And obviously, this is exciting news for all Canadians who are waiting their turn to get vaccinated. I will also say that while we wait our turn, it's important to remember that we do need to continue to protect ourselves, our loved ones, and our communities. So that means the things that we've been doing for so long, washing our hands, staying physically distanced, staying home when we're sick, reaching out for a test, even if we're slightly worried about our condition, slight fever, a slight cough, call public health. Please ask to get tested. Make sure that we know that we're protecting our families and our communities. I also want to thank all of the travelers who are complying with our new border and quarantine measures. Of course, these measures are in place to protect Canadians against variants of concern. It allows for our country to be able to analyze the virus as it enters our country, as it shifts and changes. We are at a critical time in our fight with COVID-19. As we see new vaccines arrive, we want nothing to stop our progress. And so I want to thank Canadians who are complying with the quarantine measures, complying with the border screening measures. This will help protect our communities and will help us in our fight against COVID-19. These times are stressful. I know that. I know many people are worried. Despite the good news today, there continues to be anxiety in communities that are seeing cases rise. Please don't forget about taking care of yourself, your mental health, the mental health of your close ones. And I remind everyone about wellnesstogether.ca, a free resource that is open to all Canadians in both official languages with translation into 60 others. Don't hesitate to check out this resource online for support if you're needing it. It's a sign of strength to reach out for help. And I want to thank all Canadians in their resiliency and their strength. Thank you.
Thank you, Dr. Tam.
Hi everyone, bonjour à toutes et à tous. To date, there have been 858,217 cases of COVID-19 in Canada, including 21,865 deaths. Currently, there are 30,335 active cases across Canada. Over the past week, an average of 97,120 tests were completed daily, of which 3.2% were positive for COVID-19, and an average of 2,960 new cases and 52 deaths were reported daily. During the same period of time, 2,269 people with COVID-19 were being treated in their hospitals each day, including 564 in critical care. Although COVID-19 activity has been declining nationally for several weeks, we are keeping a close eye on increased case counts over the past few days. In particular, average daily case counts have increased, ranging from 8 to 14% higher in Ontario, British Columbia, and Alberta, as compared to last week. In addition, the number of cases involving the more contagious B.1.1.7 variant of concern continues to increase, with the highest numbers to date being reported from these same three provinces. To date, there have been 964 B.1.1.7, 44 B.1.351, and 2 P1 variant cases reported across Canada, with daily case counts still elevated, almost 75 times higher than the peak of the first wave, and more contagious variants spreading. The risk of rapid reacceleration remains. At the same time, new variants continue to emerge, and those with an advantage, such as the ability to spread faster, can become predominant. Given a much narrower margin of error with these variants, controlling the epidemic will be much more difficult. This is why we must do our best to prevent spread now and avoid more illnesses and loss that would follow. I know we're all tired, but we are getting closer every day. Considering how far we have come, let's keep working together to achieve the successful outcome we've already worked so hard for. Our progress on the vaccine front continues to give us reason for optimism. To date, over 1.7 million doses of COVID-19 vaccine have been administered across Canada, and there are early indications of high vaccine efficacy, high vaccine effectiveness among some other populations at the highest risk of severe outcomes or exposure, who are being targeted by priority vaccination programs. As vaccine programs continue to roll out, Federal, provincial, and territorial authorities are continuing to monitor vaccine safety. To date, as of February the 19th, there have been 1,235 reports of adverse events following immunization. These reports include any medical event that occurs following immunization, but is not necessarily related to the vaccine or the immunization process. A total of 167 of these reports to date, about 1 in 9,000 doses administered, were considered serious, such as severe allergic reactions. All adverse events are subject to review, and all serious events undergo a detailed investigation to determine whether or not they are related to the use of the vaccine. To date, no unexpected vaccine safety issues have been identified. As we continue to make progress, I urge Canadians to remain vigilant, continue to follow local public health advice, and consistently maintain individual practices that keep us and our families safer. We are stronger together, and together we are achieving great things. Thank you.
Thank you, Dr. Tam.
Bonjour à toutes et à tous. Bonjour à toutes et à tous. À ce jour, il y a eu 858 217 cas de COVID-19 au Canada, dont 21 865 décès. Nous enregistrons actuellement 30 335 cas actifs dans tout le pays. Au cours de la dernière semaine, 97 120 tests en moyenne ont été réalisés tous les jours, dont 3,2% se sont avérés positifs. Nous avons recensé en moyenne 2 960 nouveaux cas et 52 décès chaque jour. Pendant la même période, 2 269 personnes atteintes de la COVID-19 étaient traitées tous les jours dans les hôpitaux canadiens, dont 564 étaient aux soins intensifs. Même si la transmission de la COVID-19 diminue à l'échelle nationale depuis quelques semaines, nous surveillons de près l'augmentation du nombre de cas enregistrés ces derniers jours. Plus particulièrement, le nombre moyen de cas signalés quotidiennement a augmenté de 8 à 14% en Ontario, en Colombie-Britannique et en Alberta par rapport à la semaine dernière. De plus, le nombre de cas du variant préoccupant B117, plus contagieux, est toujours en hausse et les chiffres les plus élevés ont été enregistrés jusqu'ici dans ces trois provinces. À ce jour, 964 cas du variant B117, 44 cas du variant B1351 et 2 cas du variant P1 ont été signalés au Canada. Puisque le nombre de cas quotidiens demeure élevé, près de 75% plus élevé que le pic de la première vague et que des variants plus contagieux se propagent, il existe un risque de recrudescence. Qui plus est, de nombreux variants continuent d'apparaître et ceux qui présentent un avantage, comme la capacité de se transmettre rapidement, peuvent devenir prédominants. Comme la marge d'erreur est très mince avec ces variants, il serait beaucoup plus difficile de gérer l'épidémie. C'est pour cette raison qu'il faut faire de notre mieux pour prévenir tout de suite la propagation et éviter qu'il y ait d'autres cas et décès. Je sais que nous sommes tous fatigués, mais nous sommes dans la bonne voie. Compte tenu des progrès si durement acquis, poursuivons nos efforts collectifs pour parvenir aux résultats escomptés. Nos progrès sur le plan de la vaccination nous permettent encore d'être optimistes. Près de 1,7 million de doses de vaccins contre le COVID-19 ont été administrées jusqu'à maintenant au Canada et des renseignements préliminaires donnent à croire que les vaccins sont très efficaces chez certaines des populations qui courent un grand risque de complications ou d'exposition et qui sont visées par les programmes de vaccination prioritaires. Les autorités fédérales, provinciales et territoriales continuent de surveiller l'innocuité des vaccins pendant la mise en œuvre des programmes de vaccination. Au 19 février, 1 235 effets secondaires suivant l'immunisation avaient été déclarés, ce qui comprend tous les problèmes de santé qui ont fait suite à la vaccination, mais qui ne sont pas forcément liés au vaccin ou au processus de vaccination. Parmi ces effets, 167, soit environ 1 sur 9 000 doses administrées, étaient considérées comme graves. Il peut s'agir, par exemple, d'une réaction allergique sévère. Tous les effets secondaires font l'objet d'un examen et, s'ils sont graves, une enquête approfondie est effectuée pour déterminer s'ils sont attribuables ou non à l'utilisation du vaccin. Aucun problème d'innocuité inattendu n'a encore été déclaré. Tandis que nous continuons de réaliser des progrès, nous encourageons les Canadiens à rester vigilants, à suivre les conseils des autorités de santé publique locales et à toujours appliquer les pratiques individuelles pour se protéger et protéger leur famille. L'union fait la force et, ensemble, nous accomplissons de grandes choses. Merci.
Merci, Dr. Njoo. Le premier ministre répondra à des questions pour 20 minutes. Nous allons avoir les docteurs, ministres et Major-Général Fortin qui resteront pour répondre à d'autres questions, une sous-question. Thank you, Dr. Njoo. The Prime Minister will answer questions for 20 minutes. Ministers, doctors, and Major-Général Fortin will remain available to answer more questions afterward. Starting with the phone today, one question, one follow-up. Opérateur, c'est à vous.
Thank you. Merci. Première question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, M. Trudeau. On a obtenu des chiffres là, qui démontrent que Québec dispose des milliers de tests rapides qui vont expirer très bientôt, là, en avril. Il y a une petite fraction de ces tests seulement qui ont été distribués aux entreprises et aux écoles qui en ont fait la demande. Je me demandais quelle est votre réaction face à ce constat et est-ce que le gouvernement fédéral va en renvoyer d'autres là, au Québec, sachant qu'ils pourraient être gaspillés?
Nous sommes en train de travailler continuellement avec les provinces et territoires sur l'utilisation des tests rapides. On comprend à quel point, avec ces nouvelles variantes, ça va être important d'amener cette technologie de façon plus active pour pouvoir garder la population en sécurité, même avec un certain déconfinement. En même temps, nous sommes en train de travailler avec le secteur privé pour s'assurer qu'il y a d'autres options pour utiliser des tests rapides parce qu'on sait que ces tests rapides vont être un moyen de nous garder en sécurité à l'approche du printemps. Dominique, est-ce que tu as un peu ajouté sur le travail que tu as fait avec les provinces sur les tests rapides?
Merci, Monsieur le Premier ministre. Vous avez raison. Lors de nos discussions aux 2 semaines, la question a été abordée et je sais que la ministre Hajdu, entre autres, discute avec ses homologues. Moi, certains gouvernements ont demandé d'avoir accès davantage à ces tests rapides. Il y a des entreprises, des secteurs de l'économie qui leur demandent davantage. Alors, nous allons continuer, évidemment, de donner aux provinces les tests rapides qu'ils peuvent utiliser.
En suivi, Catherine?
Oui, absolument. Et dans le fond, je veux revenir au vaccin. Bon, il y a beaucoup de Canadiens cette semaine qui regardaient avec envie le Royaume-Uni, là, qui, lui, a annoncé un possible déconfinement et un possible retour à la vie normale au mois de juin. Je me demandais, avec l'approbation d'AstraZeneca aujourd'hui et possiblement d'autres vaccins qui pourraient être approuvés bientôt, est-ce que le Canada peut espérer un retour à la normale avant la fin septembre?
Bien, certainement, on espère pouvoir se déconfiner et retourner à la normale le plus rapidement possible. C'est pour ça qu'on travaille à tous les jours pour obtenir plus de vaccins plus rapidement pour les Canadiens, avec les nouvelles d'aujourd'hui qu'on va avoir 6,5 millions de doses avant la fin mars et des dizaines de millions de doses au mois d'avril, mai, juin. On sait qu'on a bien entamé la situation et cette vaccination en masse dans les semaines à venir, mais par rapport à quel genre de comportement et quel genre de réponse on va pouvoir avoir en matière de santé publique, il faut vraiment suivre plusieurs différents facteurs, dont le taux de vaccination, mais aussi la présence de variantes, des éclosions dans certains lieux, les pourcentages de vulnérabilité. Mais je sais que c'est un enjeu que Santé Canada est en train de regarder de façon très attentive. Alors peut-être que je peux tourner vers la Dr Tam ou le Dr Njoo pour une réflexion sur à quel moment on pourrait peut-être se relâcher. Okay, before I turn to the doctors, Obviously, we all want to get back to a semblance of normality as quickly as possible. And that's why, as a government, we're working every single day to get more vaccines more quickly into the arms of Canadians. And it's good news that we have today that we can announce 6.5 million doses to be arriving by the end of next month, by the end of March, and tens of millions of doses scheduled to arrive at the very least in April, May, and June. So we're well on our way, but what actually that's going to mean in terms of loosening of public health rules will depend on many factors, including vaccination rates, but also the presence of variants, of a third wave, issues like that. And with that, I'm happy to turn to Drs. Tam or Njoo for comments on what we're looking at in terms of what those recommendations could be. Theresa?
Dr. Tam?
Sorry, the reception just getting a little bit slower on my end. But I actually would just echo what the Prime Minister has said. And that, of course, we would all want to get to a spot where there's less of those more restrictive measures. There are a number of ways to do that.
Theresa, your sound is really not coming through well. Perhaps we can see if Howard's sound is better.
And secondly, may I just check to see if my line is still okay?
Yeah. Yes, it's Dr. Njoo. I'll answer in English and maybe also in French. Certainly, not much to add to the Prime Minister's answer. I think it was very complete. The fact is that certainly with the introduction of another vaccine to our portfolio of vaccines, that's very important. But there are other factors to consider as well, the emergence of variants. And of course, with our public health measures, I don't think we can just rely on the vaccines alone to be the silver bullet. People need to understand that we need to keep the public health measures in place with respect to at least personal behaviors. I think that's very important that people recognize that we need to keep at it in terms of practicing good personal behaviors. Certainly, the public health measures at a population level, there is, I think, obviously in the different provinces and territories, a starting of loosening, but I think that has to be tied very closely to a good surveillance, watching what the situation is, looking at the indicators, and certainly if there's any indication that the case rates and certainly the emergence of variants are increasing, that we would need to adjust as appropriate. But the vaccinations, and I think certainly the introduction of vaccines and more vaccines coming to Canada is very, very good news. Je sais pas ce que je dois répéter en français, ça marche, je pense.
Oui, bonne idée. Rapidement en français.
OK. Je pense que l'introduction des vaccins, c'est très important, mais c'est très important aussi de ne pas lâcher les mesures de santé publique, particulièrement les pratiques individuelles. Je pense que tout le monde, aussi avec relâche scolaire au Québec, et c'est très important d'être prudent, de continuer de pratiquer les bonnes pratiques individuelles, parce que les vaccinations tout seul, c'est pas assez. On sait que avec l'apparition des variants, c'est quelque chose, un enjeu préoccupant, on surveille étroitement, mais c'est sûr qu'il faut continuer avec les bonnes pratiques de santé publique. Mais en fin de compte, c'est vraiment des bonnes nouvelles aujourd'hui avec l'introduction d'un troisième vaccin approuvé au Canada.
Thank you, Dr. Njoo. We'll go back to the phone. Opérateur, prochaine question au téléphone.
Thank you. Merci. Next question, Ryan Tumulty, The National Post. Line open.
Yeah, good afternoon, sir. I'm wondering with the AstraZeneca vaccine, I understand a big majority of our shipment, the 20 million shipment, is coming from the U.S. Did you get some assurances from President Biden that he won't interfere with that shipment in any way?
So far, all of our indications are that those vaccine doses are going to be arriving in Canada as scheduled during the second quarter. But for more specifics, I'm happy to turn to Minister Anand to talk about the AstraZeneca order of 20 million doses. Anita.
Thank you so much, Prime Minister. Yes, the Prime Minister is exactly right that we are receiving positive indications that we will be on track to receive our 20 million doses from the facility in the United States. Those are the 20 million doses that we have under our bilateral arrangement with AstraZeneca arriving in Q2 and Q3. And in addition, as announced today, we wanted to make sure that Canadians had access to AstraZeneca vaccines as soon as possible. And as a result, we have been negotiating with the Serum Institute of India since August 2020. And those negotiations came to fruition, finalized yesterday, so that we can ensure that the AstraZeneca vaccine being produced by the Serum Institute of India will be arriving in the coming days and weeks. Thanks, Ryan.
Following up, Ryan?
Yeah, sir. You were asked before about returning to normal. From what we've read and what the experts have said, getting most seniors vaccinated should reduce the number of deaths and dramatically reduce the number of hospitalizations. Is that enough in your mind to start returning Canadian society to normal, to start seeing more openings and getting businesses back to normal?
Like you, Ryan, like millions of Canadians and people all around the world, I am reading all sorts of different reports by different experts on, what could happen, what might happen. If you hit this, you could do that. If you do this, we can do that. There are an awful lot of extraordinary experts around the world, giving helpful advice on what next steps we can take and how we take them. Here in Canada, we rely on people like Dr. Tam and the experts and the vaccine task force and the immunity task force. We will continue to follow the best expert advice in terms of what we can do to reopen and get back to normal as quickly as possible without compromising the safety of Canadians.
Thank you. Operator, last question on the phone.
Thank you. Merci. Prochaine question, Marie Vastel, Le Devoir. À vous.
Oui, bonjour, Monsieur Trudeau. Ma première question porte sur cette idée d'un passeport de vaccination. Hier, le ministre de la Santé du Québec a dit qu'il y songeait. En fait, c'est en préparation au Québec pour faciliter un déconfinement. Je voulais savoir, est-ce que votre position a évolué sur la question ou logez-vous sur cette idée d'un passeport de vaccination?
Je pense que c'est une idée dont les gens discutent depuis un petit bout de temps. Je pense que c'est important de suivre les recommandations des experts à chaque étape. Il pourrait avoir des conséquences néfastes, il pourrait avoir des bénéfices par rapport à les mesures qu'on va recommander ou qu'on va prendre en termes de santé publique. On va toujours écouter les experts. I think this idea of vaccine immunity, passports, such is one that has been talked about for a while. There are potential pros and cons that I've heard on various issues surrounding it. Our position as a government is always going to be to rely on the best advice of experts in terms of how we can move forward in ways that both encourage a return to normalcy as much as possible, as quickly as possible, while not putting at risk Canadians' health or other elements in our community. So we'll continue to pay close attention to the recommendations that our experts make in terms of measures like that.
En sous-question, Marie?
En tout respect, c'est un peu vague comme réponse, en fait. Précédemment, quand vous avez posé la question l'automne dernier ou enfin cet hiver, vous aviez écarté l'idée d'un passeport vaccination, vous n'étiez pas favorable. Donc, est-ce que j'en comprends que là, vous êtes ouvert à la chose et que c'est présentement à l'étude? Et pour ma sous-question, qu'est-ce que vous pouvez nous dire sur l'efficacité des vaccins AstraZeneca contre les variants? Il y a des craintes dans certains pays que ce n'est pas efficace. Qu'est-ce que vous répondez à ça?
Tout d'abord, on sait et on l'a vu depuis les débuts, Marie, que les informations, les recommandations des experts évoluent et certainement, nous devons de continuer de les écouter et de continuer à suivre leurs meilleurs conseils, que ce soit par rapport à une mesure ou une autre. Et par rapport à l'efficacité d'AstraZeneca, je suis très content de pouvoir passer ça à un des experts. Je pense peut-être les docteurs docteur ou la ministre Hajdu ou la ministre Anand, comme vous voyez.
Okay. C'est Dr. Njoo, peut-être.
Go ahead, Dr. Njoo.
Je pense que... OK. Moi, je pense qu'avec l'introduction le vaccin AstraZeneca, c'est toujours bon parce que c'est notre outil, ça s'ajoute à notre comme des portefeuilles des vaccins. L'efficacité, oui, selon l'approbation de Santé Canada, c'est comme 62%. Mais c'est toujours important de garder tout le profil, on peut dire, de chaque vaccin parce qu'il y a toujours, comme il dit, une meilleure utilisation dans un programme de vaccination parce que c'est plus facile à manipuler comparé aux autres vaccins comme Pfizer et Moderna à date. Ça, c'est une considération. Je ne sais pas c'est quoi l'autre aspect de question, j'ai oublié.
C'était par rapport aux variantes.
Aux variants, OK. Oui, ça, c'est quelque chose. On continue à suivre l'expérience dans les autres pays, aussi les données probantes et aussi même les compagnies, je comprends, les compagnies comme Pfizer, Moderna, AstraZeneca continuent aussi de faire des expériences dans leur laboratoire pour toujours évaluer l'efficacité. Est-ce que c'est nécessaire? Est-ce que c'est possible de modifier leur vaccin peut-être avec les variants? Donc, c'est un enjeu actuel. Et on continue à surveiller qu'est-ce qui se passe actuellement à travers le monde. Mais pour l'instant, avec notre expérience ici au Canada, les vaccins, la vaccination, on a des bons résultats à date avec l'efficacité des vaccins parmi les personnes vaccinées, par exemple, les aînés dans les CHSLD au Québec.
Thank you. On va maintenant prendre les questions dans la salle. We'll now take questions in the room.
Good afternoon, Mayor Abston from the Canadian Press. Just wondering, in your conversation with the U.S. President this week, or following that, what exactly do you think the United States can do to help secure freedom for Michael Spavor and Michael Kovrig?
As we said from the very beginning, this is an issue that is a top priority for us as a country to secure the release of Michael Spavor and Michael Kovrig. The United States obviously has a significant role to play, and we will continue to work with them. But because these are processes that are ongoing, I won't comment on the details of it other than, as I've said, to reiterate that the United States is taking their role in this very seriously, and we look forward to working with them on bringing the two Michaels home as soon as possible.
Glenn McGregor, CTV News. Prime Minister, the allegations against Art McDonald are apparently serious enough that he stepped aside as CDS. Wondering, when you appointed him, announced his appointment before Christmas, did you know about any of these allegations? And if you didn't, do you now know about them? And why do you think you weren't informed about them earlier before you selected him?
Let me begin, Glenn, by reiterating that every single person in this country deserves a safe place to work in, free from harassment or intimidation. This is something that is extremely important, and it's something we've taken strides on, both in our government and in the military, but there's always more to do. One of the most important things is that processes be followed every step of the way, and because there is an ongoing review into this situation and we're ensuring that all the steps are properly taken, I won't be commenting specifically on this process at this time, other than to say that the following of all the steps in this to make sure that everyone has a chance to be heard and that people understand how seriously we take all these concerns and issues is important. Okay. Je pense que c'est important de souligner d'abord que personne ne devrait être dans une situation de travail où ils ne sont pas en sécurité, où ils sont victimes d'harcèlement ou d'intimidation. C'est pour ça que nous avons mis en place des mesures sérieuses en tant que gouvernement et au sein des forces armées pour faire des suivis. Et chaque fois, n'importe quand que des allégations ou des préoccupations sont soulevées, on fait des suivis dans les processus rigoureux pour s'assurer que tout le monde ait la chance de se faire entendre. Parce que c'est une situation dans laquelle il y a une enquête en cours et un processus en cours. Je vais pas commenter les détails de ce processus, sauf pour dire qu'on est en train de s'assurer que chaque étape soit suivie à la lettre.
Next question in the room.
Hi, Prime Minister. Mercedes Stevenson, Global News. My inbox is full of emails from women who have experienced sexual misconduct in the Canadian Armed Forces under your government's watch. And today you're telling us that everyone has the right to a safe workplace, that you're committed to that. But you extended the term of a chief of defense staff who is accused of sexual misconduct and under police investigation. You personally appointed another chief of defense staff who had to step down 6 weeks later due to this. And the only answers we're getting in terms of accountability is that an email was sent to the Privy Council office and that you're committed. What do you say to these women who are wondering whether you're actually serious about this and what steps you're going to take because they're feeling like they're losing trust in the chain of command, that this is systemic at the highest levels of the military, and that your government is not taking action?
I think what we've seen with the current Chief of Defense Staff choosing to step aside because of these allegations demonstrates that the military and that the government takes extremely seriously any allegations of the sort. We have done that. I have personally done that as leader from the very beginning, and we will continue to ensure that everyone who works in the government or in the military or anywhere across the country is heard when they come forward with challenges or allegations or concerns. We have a lot of work to do in our systems, in our workplaces across the country to continue to move forward on making sure that they are safe and free from intimidation and harassment and sexual assault. We have made great strides as a country over the past years, over the past decade, but there is an awful lot more to do. And I think if we can highlight, as we have, that no one is out of reach of concerns and allegations like this, that they will always be taken seriously. And I want to say to anyone who has survived incidents or issues of sexual assault that we will be there to listen, to hear them, to work with them, and to move forward through processes that will get to the right answers.
Français, s'il vous plaît.
Je pense que ce qu'on a vu au cours des dernières semaines et ce qu'on entend souligne à quel point que chaque personne dans ce pays qui travaille pour le gouvernement, pour les forces armées ou n'importe où a le droit de travailler dans un environnement sain et libre d'harcèlement ou d'intimidation. Nous allons toujours prendre ça au sérieux et ce qu'on a démontré et ce que le chef d'état-major de la Défense a démontré quand il a choisi de se retirer de son poste pendant que l'enquête est en cours, c'est que personne n'est à l'abri d'allégations ou d'être pris au sérieux. Ou de faire des suivis sur des préoccupations et des situations comme ça. Nous allons nous assurer que chaque fois que quelqu'un avance avec des préoccupations, avec des histoires, on les adresse, on suit un processus rigoureux et responsable pour que les gens soient entendus et appuyés, et que en même temps, on travaille encore plus fort pour transformer nos systèmes, nos institutions, pour bien mettre fin à ces histoires qui sont toujours troublantes.
Thank you. Next question in the room.
Prime Minister, just to follow up on that, your government was made aware of these allegations in 2018, 3 years ago. 3 years ago that your government had something you could have done about this. There was no further inquiries made by the defense minister. He apparently didn't tell you based on what we're hearing in question period. You're saying you learned about this from media reports. Isn't there a responsibility in your government to take political action when this kind of an allegation is brought forward? Are you satisfied with how the minister handled this? Because you're saying, you know, you've always taken the appropriate actions, but this was an email and that was it.
There are processes in place that we have put in place, that we have strengthened, that we expect will be followed in every single situation. Every case is different, and the processes are rigorous. And that's why there is a review going on right now to make sure that indeed all the appropriate steps were followed so that we can ensure that there is accountability if the appropriate steps weren't followed, and to make sure as well that the systems we have in place are adequate, are the right ones. If all the steps were followed and it shows that the system isn't strong enough, well, we will strengthen that system. We know that these problems have been going on for many years in many systems and institutions, and we need to change them. We have taken significant steps, but as has been highlighted, there's always more to do, and we will continue to do more to support survivors, to support people who come forward.
Merci. Prochaine question dans la salle.
Laurence Martin, Radio-Canada. Bon, avec AstraZeneca qui n'est efficace qu'à 62% et les autres vaccins déjà approuvés par Santé Canada qui sont efficaces à plus de 80%, est-ce que vous craignez que les Canadiens se magasinent un vaccin d'une certaine façon ou refusent de prendre AstraZeneca, comme c'est le cas déjà dans d'autres pays?
Je pense que d'abord, c'est des bonnes nouvelles qu'on a plus de vaccins, qu'on a différents types de vaccins. Notre comité expert qui donne des conseils sur comment et où utiliser ces vaccins va continuer de faire le travail pour prendre des recommandations et d'avoir des options en termes de système de vaccination. C'est une bonne chose. Mais nous savons que d'être vacciné avec un vaccin approuvé par Santé Canada, c'est toujours mieux que de ne pas se faire vacciner. Et nous espérons que nous allons pouvoir voir ces vaccins dans les bras du plus grand nombre de Canadiens le plus rapidement possible, parce que dès qu'on commence à avoir assez de vaccination dans la population de toutes sortes de différents types de vaccins, nous allons pouvoir commencer à avoir un retour vers la normalité.
We'll take one last question.
Hi, Prime Minister. Tom Perry from CBC. I'd like to go back to this week's vote on declaring the genocide in China. Why did you and your cabinet decide to sit out that vote? Also, I'd like to ask you on the definition of genocide. You've said you want to dot the I's, cross the T's before you say whether China's committing genocide. But when the Missing and Murdered Indigenous Women and Girls report came out, you accepted its findings that Canada was committing genocide. So why are you ready to accept that Canada is committing genocide and not China?
On your first question, Tom, I think it's really important that parliamentarians can speak out and can highlight concerns that they have and concerns that they've heard and represent the voices of their constituents. And that's why it was important that Parliament was able to have a vote on this. But a government has a responsibility that goes beyond a legislative assembly, and we need to make sure that we are moving forward appropriately and actually following up with the kinds of actions that are going to put an end to human rights abuses. And that means working with our allies. That means, as I did last Friday, bringing it up with the G7 and having a discussion about how we can move forward in a concerted fashion to make determinations and to ensure the appropriate international bodies weigh in, and then to move forward on sanctions and consequences in a coordinated way. That's the responsibility that a government has, and that's one that we take very, very seriously. In regards to the question of the report on missing and murdered Indigenous women and girls, we had an expert panel that we commissioned, an inquiry, that national public inquiry that we had long promised, that we delivered on over the past years, that looked into this situation, that heard from testimony from thousands of Canadians, of families, really dug into the issue with full access across the country to what was going on and came to a determination. And that's very much what we want to see in the international community. We want to see investigative bodies able to look into this and make a determination, because it is not a situation to be taken lightly. We have, for the past many years, been highlighting our real and deep concerns about the human rights situation in Xinjiang with the Uyghurs and with the treatment of ethnic minorities in China, including directly to the Chinese government. And we will continue to highlight those concerns while we work with the international community on charting the right path forward.
Thank you, Prime Minister. C'est tout le temps que vous avez avec nous aujourd'hui.
Je pense que tout d'abord, c'est important qu'une assemblée législative, que les députés puissent se prononcer sur un enjeu aussi sérieux que la situation des Uyghurs. Nous trouvons ça extrêmement important que l'Assemblée puisse, que le Parlement puisse se prononcer là-dessus. Mais en tant que gouvernement, nous avons des responsabilités additionnelles d'agir, de coordonner avec nos alliés, d'assurer que les mesures et que les rapports et les réponses soient trouvées de la bonne façon avec la communauté internationale. Et c'est pour ça que j'en ai parlé avec mes collègues du G7 vendredi passé, pourquoi nous travaillons ensemble pour coordonner et nos questions et les réponses que nous allons offrir sur les mesures sur lesquelles on devrait s'avancer. Par rapport à l'enquête sur les femmes autochtones disparues et assassinées qu'on a lancée quand on est venu au pouvoir en 2015, c'est une enquête qui a été chargée pendant des années d'écouter des témoignages, de voyager à travers le pays, d'avoir accès à tous les faits nécessaires pour tirer leurs conclusions sur comment on peut mettre fin à cette situation et comment on va reconnaître et aider les victimes et leurs familles. C'est quelque chose que nous voulons voir à Xinjiang. Nous avons besoin d'avoir des rapports et des enquêtes et des enquêteurs indépendants pour faire des déterminations sur ce qui est en train de se passer et sur les prochaines étapes à prendre. C'est pour ça que nous prenons depuis plusieurs années extrêmement au sérieux la responsabilité de souligner les droits humains et même directement avec le gouvernement chinois. Et nous allons continuer de rester fermes dans nos convictions, de trouver des réponses et de trouver les actions nécessaires pour mettre fin à ces abus.
Merci beaucoup, Monsieur le Premier ministre. On va maintenant prendre les prochaines questions au téléphone pour les ministres, docteurs et le major général. Opérateur, c'est à vous.
Thank you. Merci. The next question, Marika Walsh, The Globe and Mail. Line open. Ms. Walsh?
Sorry about that. Thanks for taking my question. Ms. Anand, I'm wondering if you can clarify whether this changes the timeline for Canada's vaccination. Is the timeline still the end of September, or would we now see everybody vaccinated, for example, by August?
Hi, Marika. Thanks for your question. I'm going to start, and then I'm going to hand it over to Minister Hajdu. My role is solely to procure vaccines, and that's exactly what I am doing with my team at PSPC. We are making sure that we have early access to vaccines. So, for example, this transaction with the Serum Institute of India today is one example of the way in which we are ensuring the earliest possible access to approved vaccines. With 500,000 doses coming in the next days and weeks, and then 1.5 million doses of that vaccine coming over the next months, and in total 22 million of the AstraZeneca vaccine. In total, combined with the Pfizer and Moderna vaccines as being approved vaccines. So you're correct that the numbers that we are seeing and plan to see of approved vaccines are increasing as a result of the AstraZeneca approval today and the transaction with the Serum Institute. And in particular, we're going to see 23 million of Pfizer and Moderna in Q2 and Q3, 20 million of AstraZeneca in Q2 and Q3, 2 million of the Serum AstraZeneca doses, and 1.9 million of the COVAX doses. So in total, that's 107.9 million approved doses. In terms of the timelines, that you refer to in your question, that would be something that I will ask Minister Hajdu to comment on, given her role with the Public Health Agency of Canada in the distributions. But by all means, we are moving up doses and deliveries of doses with the end in mind of accelerating timelines. Thank you.
Well, thank you very much, Anita, and thanks, Marika, for the question. I'll just say, obviously, earlier doses arriving earlier than we expected and in greater volume is a good news story, and it possibly could accelerate sort of our targets and our goals. But of course, we've seen that there can be bumps in the road, and things can happen on the manufacturing side. There can be challenges along the way. So I think we have realistic targets. Of course, if we achieve our goal of every Canadian having access to immunization, to vaccination earlier than the end of September, that's good news. And certainly we are working on that. But I just want Canadians to know that there are things beyond our control, such as the bumps that we saw with Pfizer and Moderna earlier in the month, where unexpected challenges on the manufacturing side can arise. There can be a number of other challenges from from an export perspective. And so, we obviously know that it's important that we remain aggressive in getting as many doses as soon as possible. And that's exactly what Minister Anand and her team are doing. But also being realistic that there are sometimes situations that we can't control.
Following up, Marika?
Yeah, thank you. Ms. Anand, the last update from your office on the cost of the vaccine was released in the fall. At that point, the number released was over $1 billion. Since January, your office has been telling me that an updated number or estimate of the cost so far would be released. Can you give us that update? How much total has the government now spent on vaccines?
Okay, thanks, Marika. I'm going to respond and then ask Minister Hajdu if she has anything to add again. We are continuing to make sure that we have the most accurate number possible before providing that to the Canadian public. And as I said, there are a number of transactions that are currently ongoing or have just occurred, including the exercise of options and now this transaction with the Serum Institute. So we want to make sure that that number is accurate, and we are working with the Public Health Agency of Canada, that is the body for which we are procuring these vaccines prior to distribution to the provinces and territories. And in that vein, I will ask Minister Hajdu if she has anything else to add.
Well, not particularly, other than to say that the cost of not vaccinating as urgently as possible is significant. And so our focus has always been on getting vaccines to Canada as soon as possible. That's what Canadians expect. And as I think Dr. Njoo and many others have pointed out, that is one of the most powerful tools in our toolbox to restoring the functioning of our communities and our economy.
Merci. Opérateur, prochaine question au téléphone.
Thank you. Merci. Prochaine question, Hélène Buzetti, les groupes de l'information.
Yes, hello, Minister Anand. I'd like more clarification about the schedule, the delivery schedule, just to keep numbers as we've seen them. We know that we were supposed to receive 6 million doses of Moderna and Pfizer by the end of March, and 10.8 million extra doses between April and June. So can you tell us, for those two time frames, how many extra doses we will be getting?
Thank you so much. So you're right to point to 6 million doses of Pfizer and Moderna in Q1. And with the Serum Institute transaction of the AstraZeneca doses, that number increases to 6.5 million doses for Q1. In the following quarters of Q2 and Q3, we are going to see 23 million doses of Pfizer and Moderna, 20 million doses of AstraZeneca, 2 million doses of the Serum Institute, 1.9 million doses of COVAX. And I'm grouping all of those into Q2 and Q3 because our delivery schedule with AstraZeneca is currently being finalized now that we have Health Canada approval. So we are continuing to make sure that we have all of the all of the deliveries in terms of the quarters in which they are arriving ascertained before we provide the specific week-to-week schedules. And we will provide that to the Public Health Agency, the provinces and territories, as soon as we have that.
Yeah, so my question was specifically regarding Q2. So what you're saying right now is you don't know if any of those millions of doses will actually arrive during Q2.
Actually, I do know. What I'm going to tell you, break it down in terms of Q2 alone. We are going to see 1.5 million doses of AstraZeneca from the Serum Institute arriving in Q2. We are going to see 23 million doses of Pfizer and Moderna arriving in Q2. We are going to be seeing doses of AstraZeneca arriving in Q2 and Q3. And those are the numbers that I'm ascertaining now under our bilateral APA in terms of the delivery schedule. And I will provide those to you as soon as we have that delivery schedule finalized. Does that answer your question or not?
Well, yeah, but you mentioned 23 million for Pfizer and Moderna, and I thought it was 10.8 million. So now I'm all mixed up. Just for Q2.
Why don't I get those numbers to you directly, and we can have another conversation after this press conference.
Thank you. Merci, Madame la Ministre. On m'avertit que le Major-Général Fortin doit quitter. Donc, on va maintenant l'excuser de la conférence de presse et continuer avec une dernière question au téléphone avant de revenir dans la salle. Opérateur.
Merci. Thank you. Prochaine question, Mélanie Marquis, La Presse. À vous.
Merci. Bonjour. My question is for Mr. Hajdu. I just want to get an update on the obligatory, mandatory hotel quarantine. Prime Minister and yourself admitted that there were problems, and you committed to adjusting some of those problems. Have there been adjustments made to the program?
Thank you, Melanie. And yes, indeed, we've been adding capacity on the phone lines and refining our processes to make sure that things are moving smoothly. I will thank the Canadians and travelers that are complying with our border measures. The majority of them are, and I'll remind Canadians that this is not an option, that they must comply with the border measures when they return to Canada for the safety of themselves, their families, and of course, the country.
Okay, let me just be more specific, because I did ask those specific questions to the department and didn't get any answers. What about the idea of coming up with a website, since it's 2021? And is there some kind of surveillance from the Public Health Agency in the hotels that were chosen? Are there agents that are going there to do spot checks and make sure everybody complies with the public health rules?
Well, thank you, Melanie. First of all, the hotels that were chosen based on their ability to indicate that they could provide the level of services expected by the Public Health Agency of Canada, and that they had the processes in place to do so. And we continue to monitor that. And travelers are also given a direct line to the Public Health Agency of Canada to call if they're having any challenges in the hotel system, as well as lines that the hotels have themselves. In terms of processes, as I said, we continue to review the processes from the testing perspective, but also from the mandatory quarantine perspective, and add capacity. We have now a virtual assistant that can assist people when they are calling to inquire about hotel bookings. We do have web capacity coming, and we have added additional agents to help people that are booking hotels.
Thank you. We will now turn back to the room for more questions.
Hi, Mia Rabson from the Canadian Press. Minister Hajdu, I think this might be for you, but anyone can tackle it. The Prime Minister mentioned in his remarks today that we're calling on paramedics and all sorts of other health professionals to step up and volunteer to give injections. Are we concerned that we do not have enough people to give the vaccinations that we're getting, or is that just sort of what's already been happening?
I'll speak first, and then I think I'll turn to Dr. Tam, who's apparently back online and communicating with the medical officers of health across the country. We know that our healthcare providers across the country have been working day and night to protect people from COVID-19. They're exhausted, and they have been doing an exemplary, heroic job on behalf of all of us. Of course, we at the Public Health Agency of Canada stand by, ready to assist provinces and territories in a variety of different ways, including outbreak prevention, supports in long-term care, epidemiological support, and looking at how we can actually accelerate and support process around immunization. I think what the Prime Minister is referring to is that I think many healthcare professionals want to be part of this process. And I know provinces and territories are in the stages of planning about how they will use their full suite of professionals, including pharmacies, by the way, who are always part of immunization with influenza. And as we get more and more traditional vaccines that don't require the same kinds of storage and transportation requirements that Pfizer and Moderna do, as we receive these more traditional vaccines, it opens up a space for the vaccine to be transported more easily, to be administered more easily in some more traditional routes. And the objective, of course, is to get vaccinations out to as many Canadians as quickly as they arrive. So maybe I'll turn to Dr. Tam, and she can speak a little bit about the conversations with her colleagues.
Yes, thank you for the question. And absolutely, every jurisdiction, provinces, of course, are delivering the vaccines for the most part. And they have been recruiting many different types of health professionals and others to support their bigger vaccine rollouts. And it depends on where you are. Some provinces, and indeed at the municipal level, are partnering with paramedics. Many are partnering with pharmacists. Many have changed their regulations so that a broader group of people can administer vaccines. And so the Public Health Agency provides training and facilitate the webinars and other training needed for those health professionals to get the information that they need. But the regulatory piece is within the province and territories. To date, my colleagues and I think Major-General Fortin has been liaising with the implementation teams on the ground, and human resource overall does not seem to be the challenge. Many people are volunteering, so they're getting the ducks in a row for the escalation. As Minister Hajdu said, that for some of the vaccines that are easier to handle, influenza-like clinics and more traditional vaccination clinics will be leveraged. While I have the mic, apparently I made a small mistake, misspoke in my statement, and where I said that the current case counts are still elevated, and it should be almost 75% higher than the peak of the first wave. I think I might have said 75 times instead of 75%. Of course, that does make a difference to the numbers. And thank you for the opportunity to put that on the table, as it were.
Thank you, Dr. Tam.
And I might just step in. Could I just step in to clarify my response to Hélène for the benefit of everybody else in terms of Q2 deliveries?
Of course, Minister.
So, Hélène, I think you were asking about the 10.8 figure, and I was giving a higher number of 23 million combined. The 10.8 figure that you're referring to is Pfizer alone in Q2. Okay, so Pfizer alone in Q2 is 10.8. Moderna in Q2 is 12.2 million. And we're adding to that Serum 1.5 million doses in Q2. And COVAX is 1.9 million doses. So I just wanted to clarify that for you and for the room as well. Thank you.
Thank you, Minister, for this clarification. We'll take one more question before ending this presser.
Peut-être une question pour le ministre Dominic LeBlanc, parce que j'aimerais une réponse en français par rapport au Parti conservateur là, qui veut suspendre les quarantaines obligatoires dans les hôtels dans la foulée de ces histoires d'agressions sexuelles. Qu'est-ce que vous faites concrètement là, pour mieux protéger les voyageurs là, qui sont dans ces hôtels? Est-ce que vous allez changer des choses pour mieux les protéger?
Moi, je pense, comme la ministre Hajdu a bien indiqué, évidemment, nous prenons très, très au sérieux des allégations de la sorte. C'est complètement inacceptable, évidemment, que les gens qui sont dans ces hôtels-là soient sujets à ces menaces ou soient sujets à un méconfort, quel que soit. Alors, nous sommes en train d'augmenter, de reviser qu'est-ce qui est nécessaire pour assurer la sécurité en tout moment de ces gens-là. Mais comme nous avons dit depuis déjà quelques jours, les conservateurs ne devront pas avancer l'idée de limiter les mesures de quarantaine essentielles pour protéger la sécurité en termes de santé publique des Canadiens. Nous allons prendre des responsabilités pour s'assurer que ces sites soient convenables et soient sécures. Mais en tout moment, l'obligation de la quarantaine est essentielle pour protéger les Canadiens des menaces de santé publique et nous allons continuer de mettre en place toutes les mesures nécessaires pour protéger les Canadiens. On a entendu beaucoup de discussions les derniers jours quant aux variants et c'est pour cette raison-là que nous sommes continuellement en train d'appliquer les mesures nécessaires en termes de santé publique.
Merci beaucoup, Monsieur LeBlanc. Thank you, everyone. This is what ends today. Very long press conference.
Thank you. The conference is now ended. Please disconnect your lines at this time. We thank you.